and good afternoon. It is our regular Friday lunch and learn, and I'm so excited to be with you here. Today, we're going to talk about alternative medicine. We're going to talk about it in a different way. Now, there are some people who they just grow up and they want to do the holistic approach. And so those are really people that come in, they want to do holistic, they know that it's going to take some time to get well. However, that's what they want to do. But then there are other people who are all into the Western medical model. There's nothing wrong with that. Everybody has a choice, and we're all okay with that. But sometimes the doctors will say, well, your case is terminal, or there's really not a lot I can do for you, or this is the last resort. And so, what do you do when that happens? So, this is a scenario that we see a good deal in the clinic. We've got people that come in, they are all invested in working with their body and getting their health resolved. And they have family members who also have health challenges, but the family members are not into holistic medicine. They're not into holistic lifestyle, which is really what it is. It is a lifestyle because it is what you eat, what you drink, who you love, how you live. All of those things contribute to wellness. And so a lot of people will have family members that do not share their same philosophy, and they're trying to convince their family members to try a holistic approach because Western medicine has not worked for them. And so there are quite a few objections to that. And so we want to talk about that. And we want to talk about what really is the key in a long and healthy life. So most people, when they go to the doctor, they trust their doctor, they believe in their doctor. And when their doctor says, as happened to us, get your affairs in order because this is a terminal illness, you are just, it's like a sucker punch right in the gut. You don't know what to do. That's not what you were believing for. That's not what you had written in your life script. And so you don't really know what to do. And so this is the situation with a lot of people. And so what we want to do is, why is that? Let's uncover that. Let's talk about that. Let's see what we can do to kind of reverse that. All right. So one of the big objections is that holistic medicine is too expensive. It's too late for them to get help because Western medicine has done all that it could and it didn't heal them. And now it's too late. It's too expensive. Insurance won't cover it. Those are the three big objections. And I will tell you, I went to a Truth About Cancer seminar a few years back, and all of the medical people that were there were Western trained medical doctors. They were not people like me. They were not holistic. They were Western trained medical doctors, but they were looking at cancer in a whole different way than the traditional, we're going to do surgery, we're going to do chemo, we're going to do radiation. They were looking at it differently. And so one of the doctors, medical doctors, he stood at the front of the stage and he said, most people will only work with their doctors and do protocols that insurance covers. He said, I am telling you that insurance is the worst thing you can buy. He said, nothing that insurance will cover will help you recover. And I found that very strange that a medical doctor would say that. He went on to say that alternative methods for healing for cancer is the best way to go. However, in this country, insurance does not pay for it. So just as a little bit of a backstory, if you have followed me for any kind of length of time, you know that in 1999, my late husband was diagnosed with cancer. We did not know anything about the alternative approach. We had absolutely no idea what we were getting into. And so when the doctor said, go get your affairs in order because you're not going to live very much longer, it was just a slap in the face. We didn't believe for that. We didn't think that was the way that we should go. But we were ignorant with holistic practices. Well-meaning friends tried to encourage us, tried to get us to try something different. However, because we didn't have a frame of reference for that, hippies do herbs, pardon if that's kind of pertaining to you. That was our frame of reference. Intelligent people, scientific people, educated people, that they didn't do that kind of thing. And oh boy, was I wrong. All right. And so one of the things that we did not know is that had we done something holistic, his body could have rallied and he could have beaten the cancer and things would have been quite different for my family. Don't read into this that there's any kind of regret here or anything like that. God has blessed me with a fabulous husband. And so I am one of probably a handful of people who can say that they have been married more than once to a very perfect partner. So I'm very, very grateful to God for that. So what we want to do is we want to help you understand that just because insurance doesn't cover it doesn't mean that it's not going to be good for you and that it's not something that you should try. We do this all the time. We see that it does work. There are anecdotal evidences all over the place. People don't want to believe anecdotal evidence. They want to believe scientific evidence. And unfortunately, our medical industry here does not track holistic practices. So just going to throw that out there. One of the primary things that you need to heal is a belief, okay, a belief that you can heal. This is Dr. Heil-Mealey. He is the founder and executive director of the Energetic Health Institute. And he says all of the people who heal have at least one thing in common, the belief that they will heal. Belief may be the most essential nutrient for any healing process. And I absolutely love that. And I'll tell you why. People will come in and they will say, I have been told that I have XYZ disease and there is no hope for me. And I will say, well, let's have a look. Let me see what your body's doing. Let me see what your eye is telling me and all that kind of stuff. And so I will tell them, and I will always give them hope because there is always hope. And so I remember one sweet lady, she had come in and she had had Crohn's disease, irritable bowel syndrome for years and years and years. And the doctor said that she would always have it. If you look at the eye in iridology, you see DNA and different things. Now, iridology is not predictive. Iridology just gives you DNA. Anyway, when I looked at her eye, her bowel did not look like it was irritated. And so I really was suspicious with the diagnosis of irritable bowel syndrome and Crohn's disease. When I was speaking to this lady, I said, this is what I want you to do. I want you to do it for 2 months. This is what I think that you should do. And so I saw her at 3 weeks. I saw her again at 6 weeks. And when I first told her what protocol I wanted her to do, she said, I can't do it. And I said, why not? She said, because every time I do a protocol, I get sick. And I said, well, you're not going to get sick on this one. No one ever does, that is the truth. Okay, I'm not making this up. And anyway, she came in and we did what we did. And on her exit interview, because all of her issues had been resolved, I said, well, when you came in the first time, you said that you couldn't do this protocol because this protocol would make you sick. You did it. How do you feel and what changed your mind? She said, you changed my mind. You told me I could do it. You told me I probably didn't have to have irritable bowel syndrome all my life. You told me I didn't have to have Crohn's disease forever. I believed you. So, boom, there you go. What it is that you believe is going to determine the outcome in your health. And so I just want to tell you that belief is a big thing. In a 2018 paper, it looked at the neuropathology of give-up-itis. That's what they called it, give-up-itis. That is extreme apathy. I don't care. Nothing's going to work. I don't care, okay? It can lead to death despite there being a lack of an organic cause. It is a state that can follow traumatic stress. Mental defeat is a real pathology. Now, a lot of times people say, oh, it's all in your head, get rid of it. Well, it may all be in your head, and yes, you need to get rid of it, but you need to acknowledge it and you need to change those limiting beliefs. And we talked about this, I think last week, we talked about limiting beliefs. If you think you can, you can. If you think you cannot, you cannot. So whatever you believe about yourself, whatever you believe about your situation is what is going to be true for you. All right. There used to be a physiological maxim that was repeated by scientists for decades, and it said, you cannot heal a damaged brain. okay, the brain will not grow new neurons. Now, we know that that is not true. We know that a damaged brain can recover. However, for years and years and years, doctors have been taught that, and some doctors may still believe that. All right, but that's one of those things of a limiting belief. You want to get rid of limiting beliefs. Wanting to live and expecting to heal are essential prerequisites for meaningful action that can reverse the course of disease. There has to be meaningful action. You have to eliminate toxins. Okay, now that people don't want to do this, but I'm just telling you, if you want to get well, you've got to release the toxic burden on your cells. There's a website called the Environmental Working Group. I want you to look at that, look at all the different ingredients that cause cancer. There's an app that you can put on your phone, and it's called Think Dirty. Okay, it's an app. You put that on your phone. You can type any brand name, like just for grants, we'll just say Purell hand sanitizer. You can pop that in there. I don't know what it's going to come up with. If it comes up clean, use it. If it comes up dirty, don't use it. But it's just that easy. You can put your cosmetics in there. You can put your cleaning products in there. You can put your food products in there. You can do it all. Think Dirty is what it's called, okay? There's a medical herbalist, Brett Elliott. He says that environmental toxins are one of the worst things that we can have in our body. And he gives us the 6 most common areas of toxicity, okay? It is environmental pollution, pharmaceuticals, so anything you buy at the drugstore, all right? Food, your food is toxic. Did you know that your food is toxic, all right? Household chemicals, metabolic toxicity, and emotional stress. So if you look at your cleaning products and you get that app, it's a free app, Think Dirty, and plug all that in there, you're going to see what you're spraying around your house and what you're using as a cleaning product and what it can do to your body. The number 1 toxic ingredient, according to this medical herbalist, is alcohol. All right. Alcohol is probably the most accepted poison of our time. All right. Olga Kazan in The Atlantic in January 2020 wrote, alcohol's byproducts wreak havoc on the cells, raising the risk of liver disease, heart failure, dementia, 7 types of cancer, and of course, fetal alcohol syndrome. So, all right, this is a big deal. We don't think of alcohol as a poison unless someone is like 2 or 3 or 4 times over the limit, right? They did a Harvard study, all right, and it was a longitudinal study that followed 268 Harvard graduates. They were sophomores. They followed these sophomores for 80 years. So they followed them up through graduation and beyond. All right. And they found that alcohol abuse was among the single greatest contributors for early death, disease, and divorce. So however that plays into your life, you got to figure it out. I think the odd adult beverage is probably not going to hurt you, but those people that, that's what they look for. And we know people that are like that. I'm not making a value judgment here. This is what this Harvard study shows. All right. I'm just going to tell you holistically, when we put people on protocols, we say no caffeine, no soda, no alcohol for X many days. It's like, what? We can't do that. Well, no, it's not if you want to get well. So that is a real, that's a mindset. That's a limiting belief that you have to have alcohol in order to cope, right? You don't have to. Sometimes it does help. I'll give you that, but you don't have to. And if your health is damaged, then you need to forego it, at least for a while. The third thing that we ask people to do is change how they eat. Nobody wants to change how they eat. I belong to a diabetic Facebook group. And why do I do that? Because I am researching diabetes. Do I have diabetes? No. Does anybody in my immediate family have diabetes? No. Do I expect to have diabetes? No. However, I want to see what the challenges are and how people are coping. If you know anything about health at all, you know that if you have diabetes, you have to forego sugar and you have to forego starchy carbs. I will tell you, there is not a day go by when someone's not complaining. I don't want to give up my pasta. I don't want to give up my bread. I don't want to give up my alcohol. I want to get well a different way. I don't want to change my food. Well, guess what, honey? You're not going to get well if you don't change your diet. That is a big deal. We want you to be on the anti inflammatory diet because inflammation, chronic inflammation, leads to chronic disease, and nobody has time for that. All right. And dozens of international studies have found that diet interventions and lifestyle changes can prevent chronic diseases, including heart disease, stroke, and cancer. Dr. Steve Puckett of the Puckett Integrative Healthcare writes on his website that when you are sick, your body is vulnerable and your immune system needs support. Well, we all are going to say yes to that. He says, quote, I cannot stress enough how crucial a healthy diet is when addressing any health issues, even something as minute as a common cold. There's a saying that food is medicine. Yes, actually the saying is by Hippocrates. Let your food be your medicine and your medicine be your food. Okay, that is a real thing. And so we know that all medical professionals do the Hippocratic Oath from Hippocrates, and that was one of his maxims there. And so we want to do that. Now, remember, we do have this little gizmo, right? A 30-second test where you put the heel of your hand right here on a laser, and it tells me how you are doing with your nutrition. If your nutrition is not good, then you are not going to be well. And so this is a real easy thing. You don't have to have an appointment with me. You come in. You do have to schedule because I'm the one that does it, but it's not an hour-long appointment. You come in. It's like 30 seconds. You fill out your iPad, your name, your address. No, that's not right. Your name and your email. Then we do the scan. You're in and out in 5 minutes. It's an easy thing. So go ahead and get that scheduled, and that'll tell you what you're doing with your nutrition. If you're not absorbing your nutrition, you're not going to be well. The fourth thing you need to do is hydrate properly. Now, I'm just going to be honest. I used to think, oh, tea has water in it, coffee has water in it, juice has water in it, soda has water in it. I'm all good. I'm going to be hydrated. But au contraire, that is not how this works. Your cell wall gradient, you've got a cell wall around each of your cells. That membrane is only permeable to H2O. All right? It can be H2O that's fizzy, or it can be H2O that's alkaline, or it can just be plain old H2O, water. That is the only thing that will penetrate that cell wall gradient. Coffee will not, tea will not, soda will not, alcohol will not. All right? So you get to make the choice. When we first moved to our downtown location, we have a festival every spring where the street's closed off. It's pedestrian walkway, and we wanted people to know that we were new. We were new in town. We had just moved into this building. And so we had a flat. So if you know how many a flat of waters are, it is a bazillion, okay? And so we had a flat of waters delivered. We had our own personal labels made up so people could find us, our phone number, our email, whatnot. And we were giving these out free. They were cold. They were ice cold. In Houston, Texas, it's like balmy 80 or above, right? It's 100 all next week. And so we were giving out these waters to people just to say hi. You would be flabbergasted to have watched all the people say, no, thank you. I don't drink water. No, thank you. I never drink water. No, thank you. I'm going to go get a soda, right? So people do not hydrate properly. So you can drink whatever you like, but the only thing that's going to hydrate you is water. Your body is a bioelectric organism. Water and minerals gives you juice to make all your systems work. So if you're not eating good food, you're not absorbing your minerals, that's a problem. If you're not hydrating, then you don't have that spark for those minerals. That's a problem. So you have to use water appropriately. This doctor, who is, she's with the Mayo Clinic, says that water ensures proper digestion, prevents constipation. Water helps flush toxins from the body and promotes good kidney function, which keeps your joints and your muscles lubricated. It supports healthier and younger looking skin, and we all want that. It helps regulate body temperature. All right. She notes that the Mayo Clinic, and everybody respects the Mayo Clinic, recommends 11.5 cups, 92 ounces for women, and 15 and a half cups, which is 124 ounces for men per day. Now, coffee, tea, and soda and alcohol are all diuretics. They're going to make you pee. They're going to dehydrate you. So if you are drinking a lot of those other items, then you're going to have to up your water intake to overcompensate for that, okay? The fifth thing they say is to be self-sufficient. I don't really like that because that's not what this is talking about. This is talking about taking control of your body. You're going to get apps that tell you what to eat. You're going to blog how you feel. You're going to write down what therapies you're doing and how it's working for you so that you are always reinforcing your belief system that the body can get well. I will just tell you from 1999, when all I believed in or understood, let's say understood, was the Western medical model that I'm not sick. I've never been sick. I had scoliosis surgery when I was 12, and that's about the extent of what's going on with my body with the Western medical field. As I have been thrust into this with the death of my late husband, I now know that hydration is key, that food is key, that nutrients are key, that exercise is key. I also have a respect for alternative practitioners like a myofascial specialist, a neuropilates specialist, a chiropractor, a naturopath, an iridologist, a massage therapist, a reflexologist. You might think, I'm just going to be honest, when my husband died, I thought my world was going to come to an end, and it was a thing that I had to grapple with. My sister offered to pay for me for her massage therapist to come over and give me a treatment every week, right? I declined. Why? And you say, well, how stupid is that? Well, yes, I would agree. But why did I decline? Because I did not understand that extreme trauma knotted up your muscles, knotted up your vessels, knotted up your ligaments. And that part of self-care would have been to take advantage of that massage. But I didn't have the background to understand that. Now I know, I absolutely know that massage therapy is not just something rich people do. It's just not something that leisurely people do, people that don't work, people that have all day to sit around and eat bonbons and watch TV. They're the ones that go and get the massages, right? That is not a belief that I have anymore. Why is that? Because I investigated it. And as I have gone further in my studies, there's all these fabulous people that do all these different things. We're bringing in, and you're watching our post, you see that we're bringing in the McLaughlin scar tissue release. And oh my goodness, boom shakalaka, what's going on with that? And the way people are just, their whole internal system is just turning around and changing. Physically as well, there's more mobility and that kind of thing. So it's just absolutely amazing. So journal, take control of your health, take control of who works on you. Okay, you're not limited to this practitioner or that practitioner. Each different one is going to do something different. So take advantage of that. The sixth thing kind of goes along with that. You're building a team, right? So I have a team. I have colleagues that do the same thing that I do, if I have an issue, it's like, hey, what do you think? So I have a team. I also have a myofascial specialist. I also have a reflexologist. All right. I also have a neuropilates expert. I also have scar tissue experts. So I've got all these people in my team. Why is that? Because each one does a different thing for my body so that I can be whole. I can be well. I can be all put together. So you want to do that. The seventh thing is meditation. So in my life, in my world, meditation equals prayer. That might not be your reality, but that's my reality. The Journal of Alternative Complementary Medicine found that meditation practices elicit a relaxation response that has been documented to reduce blood pressure as well as blood pressure medication. So that's scientific evidence that prayer, meditation, whatever quietening and stillness that you practice, that goes a long way in regulating your bodily functions there. The eighth thing, of course, which is no surprise to anybody, is exercise. Exercise is absolutely paramount. You can do swimming, you can do walking, you can do running, you can do team sports, you can do all kinds of things. I care not, but you need to keep moving. Your body needs exercise to stay well. So if you are a couch potato, right, and I say this with all the love in my heart, then you're going to have some issues. Your body has to move, otherwise you're going to lose that fluidity of movement. Lack of exercise is a major cause of chronic disease, according to reams of research. Inactivity contributes significantly to chronic conditions such as metabolic syndrome. What is metabolic syndrome? That's another way of saying cancer. All right. Obesity, insulin resistance, liver disease, heart disease, cancer, and premature death. Even stretching counts as movement. Okay, so you've got no excuse. All of us can stretch. All of us. If you're 2, you stretch, because we see babies do that all the time, right? If you're 82, you can stretch. All of us can stretch. The ninth thing is getting the right amount of rest. What is the right amount of rest? I'm telling you, nobody gets it. It is 9 hours. All right. So sleep may be as important to health in old age as diet and exercise, according to new evidence from the project Demography and Economics of Aging and Alzheimer's Disease. In a review of numerous studies, they have shown that sleeping too much or sleeping too little is associated with mortality. I heard a pharmacist say he's okay with a cat nap, 20 minutes, maybe up to 45 minutes. But if you're sleeping an hour or more a day, every day, that you have a metabolic syndrome process going on in your body. So read between the lines on that. And you need to get some help if that's you. On a Saturday, I may have a snooze on a Saturday. On a Sunday, I probably always just have a nap after church and lunch and that kind of thing. It's rarely more than 45 minutes. And in my regular day, naps just don't happen. Number one, I don't need them. And number two, I'm here with you. And so that just doesn't happen. So we need to have 9 hours of sleep. That is the Goldilocks amount of sleep. That was from a 2018 cross-sectional study on sleep and chronic diseases published by the Sleep Science. That was the name of the publication, published in Sleep Science, that stated the value established for long sleep is 9 hours. Nobody that I know gets that. I don't even get that. Sometimes I'm in the bed 8 hours. I probably not sleep the whole 8 hours. All right, so I have a goal because I want to live long, live strong, right? So your magic number, the Goldilocks number, is 9 hours. The Goldilocks number for exercise is 30 minutes 3 times a week. Okay? Oh, they changed it 5 times a week. It used to be 3 times a week. 30 minutes 5 times a week. The 10th thing is to enjoy connection and your fellow humans. So this is one thing that we know suicide is on the rise. We know that substance abuse is on the rise because of lockdowns and different things like that. There is nothing more nourishing to the human soul as that heart-to-heart connection. So we need to, if we are ill, well, even when we're well, even more importantly when we're well, because it keeps us well, when we've got that heart-to-heart connection, we know that we matter. We know that we're important. We're going to take better care of ourselves because we know people love us and that kind of thing. So we want to make sure that we have emotional connections. Dr. Wayne Jonas writes in Psychology Today, quote, "When our encounter with another person results in connecting to our emotional self, especially to a part we have avoided dealing with because of fear or grief, which are emotions all too prevalent right now, the healing can be profound." Jonas says he's read studies of patients with rheumatoid arthritis who report significant pain reduction after a single episode of sharing their traumatic experiences with their illness. Patients with asthma have improved lung function, measured objectively with a spirometer a month after a similar single sharing. Similarly, people facing the challenge of enjoying life while living with long-term illness, they also find a benefit. One of the things that the article suggests is that they do find a group of like-minded people, as I was talking about the diabetic group, right? I lost earbud there. I am not, as I said, diabetic. I'm using that as a resource for something that I'm working on here at the clinic. However, if there's something that if you have chronic hypertension, hook in with those kind of people because they're going to have resources that might be better for you. It's that emotional connection. You're going to have a connection with people, and that's going to make all the difference in the world. Speaking of emotional connections, this weekend is Mother's Day weekend. Love your mom. If you are a mom, I want to be the first to say Happy Mother's Day to you. If you are not a mom, but you're a special aunt, a special sister, all those kind of special roles that we women have, then I'm going to say Happy Mother's Day to you because you probably have mothered somebody in your life, even if you may not have given birth to an actual human. Okay, so all of us can celebrate in that. Be good to yourself. Think about what I've said. Think about what you can do. Think about what your limiting beliefs are that are stopping you from reaching out to alternative resources if the Western medical model is not a good fit for you. I love you very much. I will talk to you next week. Have a great Mother's Day and do a lot of self-care.